Okay, thank you. Thank you, Rachel. And it was great to hear the noise in the room. And just so that you don't get worried later on, this is a well air-conditioned room as well, so it shouldn't get too hot. So that's good. I hope you enjoy the next 2 days. We've designed it to be a little bit different from what we normally do. And that's deliberate. That's an attempt to really try and set the scene for how we take forward the organisation from now. And I guess one of the other things I'd ask you to do is when you're looking at the presentations and the slides and taking part in the sessions, just keep an eye out for the expert actors that you will see and see if you can spot them, and also any familiar faces in the caricatures that we use on the slides. And I might just point one of those out later on. So what we want to do over the course of the next 2 days is really ask you to immerse yourself in the patient experience. Really understand how services look from a patient's perspective, and then help us to understand, so me, the board, the executive, the senior leaders of which you are a part of within the organisation, help us to understand how we can amplify our strategic direction, shaping our future well-being, how we can make that real, one for our patients, but also for our staff throughout the organisation. So, as I said, you're not the usual audience that I would speak to. The organisation works in a very hierarchical way, and therefore the people I speak to are the people on the health system management board, the clinical board directors, the directors of operations, etc. But again, it's deliberate that we've constructed today in a very different way. And the reason for that is we want to hear from people who've got a track record throughout the organisation of making decisions and acting on behalf of the patients that are in front of them. So we want to hear from you who've put the patient at the centre of what you do on a day-to-day basis, who've got that experience of working with patients, so that you can feed that knowledge and expertise through to us over the course of the next 2 days. And as Rachel said, this is Win. Win's our 76-year-old with dementia, comorbidities, living in the community, could be isolated, all of those things that you see every day within your clinics and throughout your departments. We want to use Win just to reinforce that perspective that we're here for patients. Often we will make decisions that is best for the organisation, or that we think is best for the organisation. One of the real shifts in culture that we need to make is make our decisions based on what is best for the patient, what is best for Win, and using Win as the caricature to drag us to that. So over the next couple of days, we want to create some time for reflection, time to think about our strategy shaping our future well-being, maybe to question the strategy shaping our future well-being. There's nothing off the table, in a sense, as we move forward. But what we want to get is a flavour of what we should be looking like in 5 years' time. We're 4 years into a 10-year strategy. I'll pose some questions as I go through this presentation around the progress that we've made. But really what we need to do is understand what we should look like in 5 years' time as we come to the end of that strategy, so that we can see whether we've made progress substantially or not. So this picture is one of the reasons I actually applied for the post in Cardiff and Vale. As many of you know, I was in Australia before I came here, and looking at jobs that were available. This one came up, I was looking at it and I saw this picture. And I'll talk about it a little bit more as I go through the presentation, but actually it sets out for me what a sustainable system looks like. It balances treatment with prevention. It looks at tackling health inequalities. The focus and the foreground of the picture is very much on the locality, on the community, on the patient's home, where the patient will feel most comfortable, surrounded by the people that they know. But then importantly, it's multidisciplinary and it's multi-agency. We can't do this on our own within health. We can't improve the health of the population on our own. We need to work with partners. And I'm pleased to say there are some of our local authority partners and also third sector partners in the room today. And we need to find ways of working together to join up this system for our patients. And I often say health is a team sport, and I'm reminded of a conversation I had with Sir Michael Marmot not so long ago in the Life Science Hub, where the whole body of work that Michael Marmot has done has been around the wider determinants of population health. What are the things that really impact on the health of the population? Health and the services we provide are a part of that, but they're quite a small part of that actually. It's around the economics of the area that people live in. It's around housing, it's around social justice, criminal justice system, all of those things. And so if our ambition is to improve the health of the population, then we've got to work on a multi-agency basis to be able to do that. So why are we here? Well, we want to engage with you to understand how we can amplify our strategy, how we can make it more visible through our actions. I find it quite easy to talk about the ambition that is there within the strategy. What I want to be able to do is to talk about the things that we've done that demonstrate the strategy live and in action. And I think what I want to hear from people over the course of the next 2 days is how we can do that. How do we make it real? And that's about listening to you, to understand what's important to you, but also to understand from you what's important to the patients that you see every day within your clinics, your departments, etc. So just to remind us around the case for change around our strategy, so Cardiff and Vale, the population is growing. That's been a fairly sustained growth of about 1% per year, and we're expected by 2020 to exceed 500,000 as a population. But we mustn't forget either the tertiary services that we provide for across the whole of South Wales, and for many of those tertiary services across the whole of Wales as well. Our population is growing in age as well, so over the next 5 years the number of over 85s will increase by 15%. But a more staggering figure is that in 10 years that will increase by 40%. So a significant growth in the people who use our services and require our services, the services of social care, the third sector, even more. And so there's a real driver there for us to start thinking about what the future holds, not just what it feels like now to be in the service. We've got a diverse community across Cardiff and Vale, and the needs of that community are changing, with many people living longer with comorbidities, and again that's something that we have to deal with. And when we look at some of the predictions around how our services will be affected by that, if nothing else changed within our service, so if the default position for unscheduled care continues to be our ED department, if we admit to hospital because we can't find suitable alternatives within the community, and if we struggle to find the discharges when people are ready to go home, they can go home, or when they're ready to be discharged to their place of residence, that can happen, we would predict that in 5 years' time we'll require about 400 more beds within the hospital system. Now that's not in keeping with our strategy. That would require a significant investment in hospital services. It's not in keeping with our strategy. It's not about focusing care closer to home. That's actually doing what we've probably done in the health service for many years, which is investment in hospital services, building hospitals bigger and bigger over that period of time. So I would ask some questions. Could we afford them? Could we afford another 400 beds in the hospital? I think that's probably the least of our worries at the moment. The second question would be, could we staff them? Could we get the nursing, the allied health professionals and the medical staff to be able to staff those additional beds? And I think that's a big issue. But I think the biggest issue is it the right thing to do? We know that when we admit frail elderly to hospital and when they stay in hospital for too long, they decondition, and that starts quite quickly within a hospital environment. We also know that they lose confidence. We know that they lose independence. We know that if they're in hospital for long enough, their next port of call will be a nursing home. And that's not what we envisage for our population in Cardiff and Vale. It's not what we're setting out by our strategy, and therefore it's something that we need to think now about to try and manage. So here's just a map of Cardiff and Vale, a map of deprivation. And we've got 3 localities. We split ourselves artificially into 3 localities, but those 3 localities are quite different as well. And we have some locality directors in today as well, who I'm sure can add much more detail than I can. But the southern arc of Cardiff is very deprived. It's the most deprived. If the southern arc of Cardiff was a local authority on its own, it would be one of the most deprived local authorities in the UK. And that's a significant issue and brings its own pressures on health. North Cardiff, the age of the population of North Cardiff is higher, with people living with comorbidities. So maybe more affluent society, but again, a significant burden of disease because of age and because of comorbidities. And then we've got the Vale of Glamorgan that is rural, has significant pockets of deprivation, but also has the challenges of rural isolation and bringing services to people. So we've got real challenges whenever you look at the localities as we've got them described. But I guess these are the staggering statistics that we need to look at. Life expectancy gap for men from the most deprived to the least deprived is 10 years. There's 10 years difference. Healthy life expectancy, there's 23 years difference. Now again, that's a staggering statistic. And when you think about part of our vision is that a person's chance of leading a healthy lifestyle is the same whoever they are or wherever they are. Yet within our system at the moment, we can identify a gap of 10 years for life expectancy and 23 years for healthy life expectancy. So I'll bring us back to our vision again and remind people as well, this was developed by our staff. This was developed by staff in 2014 and has been in place since then. It's a 10-year strategy, 2015 to 25, and I've already mentioned we're 4 years through that. It focuses, it identifies that health and the health of the population is a team sport. It's something we need to work with other agencies on. It's a focus on the home and the community. And the question I would ask is, 4 years into a 10-year strategy, have we made the progress that we need to make? And I think that's a question that we need to start to think about over the course of the next 2 days. I know that later you'll hear from Hugh Jaquay. Hugh is the leader of the South Wales Fire and Rescue Service, and you'll be thinking, well, why are we hearing from the Fire and Rescue Service? The story that he will tell will be how over the last 10 years they've changed that service from a fighting fires service, so an emergency service, to a preventative, a preventing fires service. Now, you know, there's many differences between us and the fire and rescue, but actually the direction of travel is very much the same. And just to hear the story of how they've tackled that from a culture perspective, how they've tackled it from an employment perspective, I think will help us to make sense of the direction of travel that we need to adopt. So in our system, there are far too many times that patients wait, I would suggest. And again, I think one of the propositions I would like to be thought about over the course of the next 2 days is one of the unifying measures for a health system could be and should be, in my mind, that we commit to not wasting the patient's time. I think if we do that, we will see, as other economies have seen across the world, and I look to our Learning Alliance with Canterbury around that. If we don't waste the patient's time, we'll not waste clinicians' time. and we will be much more productive as a result of that. But just some of the waiting times that exist on a daily basis for patients. Waiting at home after having fallen for an ambulance to turn up. Or sometimes over the winter that can be 12, 16, 20 hours. And that can't be acceptable. It wouldn't be anything we would want for my mother, my father, similar for your family members. Waiting on an ambulance to get into our ED department. Once you're in the ED department, waiting in the ED department until you're admitted to the right specialist ward. Once you're feeling better and ready to go home, waiting for the discharge, which can take days and sometimes can take weeks. And that's just in the unscheduled care area. We have many queues for outpatients, for diagnostics, for elective surgical treatments and procedures. All of those create their own work in trying to manage those queues, which divert us in spending money and effort in managing the queue and managing the waiting, rather than managing the patient, the treatment and the support that they would require. So my sense is I think this is a real opportunity for us to start to think about a unifying measure so that we can see whether we're making progress or not. So who's this guy over here? When I saw these slides, I thought someone's taking the mickey here. So I showed my wife that, and she said, well, I said, it can't be me, Jackie, because I don't wear a tie. And she said, no, it can't be you because he's too skinny on there. I don't know what she was trying to say. So the next few slides are my reflections. And I guess I've been lucky enough in my time in health to work in a number of different health systems and to work across the UK and across the world in health services. So I just wanted to give you, I guess, just some reflections on where I think we are as a health system and how I think we should move forward. And I'm focusing particularly around the role of leadership within this. So I've been a chief executive for 10 years and I've been in health for 30 years. And I guess it's took me a while, but where I've got to now is I think my job as the chief executive and as a leader within health services to create the conditions for frontline clinicians to do the best job that they can do. So when I think about, am I doing the right thing? That's what I think about. Am I creating the conditions so that you on the front line are doing the best that you can do with all of the training that you've had and all of the support from the clinical teams around you to do the best that you can do for the patient that's sat in front of you? And I'd argue that that's not just my job either, and I'd argue that that's not a job that one person can do. I think that's a job for us in this room. I think this is a job for leaders across the whole of the organisation, whether you're a departmental manager, whether you're a clinical board director, whether you're a locality director in the community. Our focus should be, are we supporting our frontline clinical staff to be able to deliver the service that they can do because they've got the skills and the expertise, but often our systems actually get in the way of that. So we've got some pockets of great work that is going on across Cardiff and the Vale. These are just some examples, and I could add loads more to that. And I would encourage everyone in this room to come to the Clinical Senate every time that it's run, because you hear the great work that people are doing, often off their own volition, to try and improve the services for their patients. Sometimes they'll tell me that they're doing that in spite of the organisation and the organisation hasn't supported them. What I'm hoping is that that gets easier because we start to support, we start to create the culture that I've described, and that gets easier for frontline clinicians to actually make the changes. But again, these are just some great examples, but have we done it enough? Are we systemised enough in our rollout of these particular developments? And I would argue that we need to speed that up. The purpose of today is, how do we speed that up? How do we capitalise on the efforts, the motivation of individuals at the front line, give them our support to actually move these things forward much more quickly? So some of the things I've learned across my time is that I do think time is a really key currency that people value. You all value your time. If after these 2 days you say these 2 days are a waste of time, then I'll probably not get you back in the room the next time I want to do that. So the pressure's on us to make sure that this isn't a waste of time. But I'm just trying to sort of draw out, time is important to professionals, it's important to, but it's also important to the patient. And I think we've got to start to look at that. And I just wanted to tell you a little story about something that didn't go so well within our health service. And we'll have to talk about some of these things over the course of the next 2 days as well. So this is Ethan. Ethan required one of his kidneys to be taken out. It took 3 years from the decision that operation was required for that operation to happen. This was it emerged as a big complaint, and quite rightly so, and it was covered within the media. Ethan's father said that he'd missed his childhood, that he couldn't take part in any contact sports. So he couldn't play rugby, he couldn't play football. When all of his friends were doing these things, Ethan had to sit and watch. He also talked about how anxious he and his wife felt whenever Ethan was out of the house, because they knew he was in a fragile position. They couldn't keep him in, but they just felt anxious, and that became a problem for them. So he had a continuous wound in his side, and that wound was prone to infection, and he was in and out of the hospital on many occasions, yet it still took us 3 years to organise and do the operation. It came to the attention of the Ombudsman, and the Ombudsman said because of the delays he'd failed to thrive as a young boy. And that's a very powerful statement to reflect back to us in the health system about how, in this particular case, we'd certainly let Ethan down. We should have been onto that much more quickly. And there will be examples like this that you will know about in many of your services. So key learnings, I think, as we move forward. Culture and values. Culture and values are the bedrock of how we do things. We need to create a high trust and low bureaucracy system to enable people at the front line to be able to do the job that they want to do. Whenever I talk about this, and Dwayne will have heard me say this just last week when I was talking to the ED staff, whenever I talk about this high trust, low bureaucracy, that's when I get the biggest smiles, because everybody thinks, well, we're the opposite of that. And I think we're the opposite of that. I think we're high bureaucracy and a low trust system. I don't think that's just Cardiff and Vale. I think that's the NHS. I think that's the way we've sort of been brought up to manage and lead over many years. But what we can see from those systems that do work better, are more responsive, is that the way to do that is to change the culture, and therefore that's something we have to do. We have to focus on what's best for Win. We have to focus on what's best for the patient. We have to understand and work hard at working as part of a team. And that team might be across professions within the organisation, but it might be a team across our agency and other agencies, the social care, local authority, third sector. And we have to create the ability to partner. And to partner well, and to create the trust within the system that if we're all focused on what's best for Win, and we all agree that independence and support to live longer and happier and healthier lives in the community, then if we put that as our focus, then we'll all be aligned on doing that. And I think that's an important message. But culture and values and behaviours are the things that will create that trust to enable us to go forward. We need to listen, and we need to listen much more actively than we currently do. We need to listen to patients, we need to listen to our public, and understand from listening what it is they actually want and expect from the services. We need to listen to staff, and this is a start in that process. It's not the end, it's not a one-off event. We will create an ability to listen in this sort of way. We'll create opportunities over the course of the next year, and then start to embed that as normal practice within our organisation. And we also need to listen to stakeholders and our partners, because as we need to do the right thing, we need to enable them to do the right thing or work with them so that we're all doing the right thing together. Again, learning, we need to give permission for people to do the right thing for the patients that they see. I've already mentioned the clinical centre, and I think that's a great environment to hear what clinicians have done in a difficult environment, in a high bureaucracy environment, yet some great things have happened. So how do we do more of that? How do we encourage people to actually take part and do more of that by reducing the bureaucracy in the system? And we need to be bold in the vision and the delivery of our services. So this is it's interesting. As I was walking in today, I walked past the Extinction Rebellion group, and they've got a boat just outside the castle, and it says "Act Now" on the boat. Act now to create a better tomorrow. So when I came in, I said to Joe, I said, "Do you really think we should do this slide? You know, because it's got the hallmarks of Extinction Rebellion." And she said, "Well, no, it's exactly the same principle. We have to act now to create a better tomorrow. Don't wait for others. Don't wait for permission. Don't wait to be told you can get on and do things. Actually act now, because we've got a long journey ahead of us. We've got a long journey in terms of culture. We've got a long journey in terms of service delivery and improvements on respecting the patient's time and all of those things. If we don't start now, we're just putting that off. And we'll get to the end of that strategy at 2025 and wonder why we didn't deliver, why we didn't actually make the progress that we want to make. And my sense is there's enough enthusiasm and enough support to actually, with these principles, to get on and act now. So this is my second last slide. So my proposition to you is the Power to Amplify 2025 is with you. We're actually wanting to engage you in how we move this organisation forward. And just to reinforce something I said earlier, this won't be the first of these. This won't be the only event like this. We will continue. We will embed this in the way that we work. But what I would ask you to do is leave your preconceived ideas at the door. Be open to new ways of thinking. Look at where you can amplify connections across the system so that we can join things up and be in a better position to provide services for our patients. Give permission to make changes within the organisation so that we can be more responsive and be bold in what you want to achieve. But above all, act now so that we can create the tomorrow that we describe, which I think is a very sustainable position for a health system within the overall confines of Cardiff and Vale, so that we can create that tomorrow in the timescales that we've described. So I'd just like to thank you for your commitment and thank you very much for attending here today. I'd encourage you to be open, to be curious, but above all, I'd encourage you to enjoy your time here over the next 2 days. My sense is, as an organisation, we do have a good time when we come together. I've been in a number of events like this. Be open, say it how you see it. Don't hide, don't hold back. If there are things that are pretty obvious, then get them on the table, because it's only by dealing with those things that will actually enable the organisation to go forward. So thank you very much for listening. If there's any burning questions, I can take those, or we can move on, because over the 2 days we'll have lots of opportunity for questions and for challenge of the system in that. But if there's anything burning, I'm happy to take a question. Nope. Okay, well, we'll move on. Rachel, thank you very much.